I first knew I wanted to be a dentist in high school. I was a junior. I was sitting in a Dunkin' Donuts with my father, and we were talking over professions and what would I do when I graduated from high school, what course of classes I would take when I went to the university. So we talked about medicine, we talked about dentistry, a little bit about science, but it came down to medicine or dentistry, and I go, well, I like the idea of not working on weekends, and I like the idea of being my own boss and not working in a hospital setting. So it quickly narrowed down to dentistry, and it never changed my mind once I decided, age 16, to be a dentist. The reason I like doing dentistry is because you can help people, you can give them back something that they lost, you can restore people. There's things about it that if you're good at it, and I feel I'm good at doing what I'm doing, that you can serve people in a better way than the average job. So it's just a way to give back better, it's a way to be more meaningful in society. It's always been known as an honored profession, and so if you want to be in a position where people appreciate what you're doing, I think dentistry is a great profession. When we got into the profession of dentistry as kids, all of us were 19 or 20 years old, we just thought we were going to fill teeth and pull teeth and make dentures. Now we're restoring smiles, we're building people's self-esteem, we're taking care of pains and getting rid of headaches. And lately we've come down to the oral systemic connection where we're actually impacting their health. The diabetes, the heart disease, the strokes that people have that are related to dentistry, we're now eliminating those through the correction of the periodontal inflammation. Yeah, my experience in dental school was probably a lot like any other student going through. You learn by practicing on each other. And so, the first day of anesthesia class, you're kind of leery of the guy next to you because he's going to be practicing giving Novocaine to you right after you've given it to him. And so it becomes a challenge to do a good job. I think to be a really, really good dentist, you've got to have a mix of skills. And of course, if you're a dentist, you've got to have surgical skills, you've got to have diagnostic skills. And so we put a lot of effort and energy into becoming the best diagnosticians we can, so we can see more, do more, and understand more than most practices. We really enjoy working with some of the best staff in dentistry here at Suwane Dental Care. Every single person that we have working here is a true professional, and they really they work hard at being the best that they can be, and they take their education seriously and they take their job very seriously. So we're very proud of having a top-notch team here at Suwane Dental. And so what I'm looking forward to now is building a consultant business with my son, and we're going to teach other dentists how to do what we've done in our practice here in Suwane, because we've been so successful and we've had so many patients that have enjoyed what we do. We're very different in how we approach dentistry here, and so we want to teach other dentists how to do that.